Welcome to my channel. Currently, 8 to 18% of women suffer from ovarian cyst. One of the most common type of cyst among them is the chocolate cyst. Many people ask me about chocolate cyst. So, in today's video, I will discuss with you number 1, what is chocolate cyst? Number 2, why do chocolate cysts occur? Number 3, what are the symptoms of chocolate cyst? Number 4, does having a chocolate cyst causes any problem with conceiving later? Number 5, how to treat chocolate cyst. So, let's get started. What is chocolate cyst? To understand a chocolate cyst, we need to understand some basic thing. Look at the picture, which show the female reproductive system. This part of the image is the uterus. The inner lining of the uterus is called endometrium. Typically, during menstruation, hormonal changes causes the endometrium to break down and bleed, which then exit the blood through the vagina, a process we call menstruation. However, in some cases, cells of the endometrium grow outside the uterus in areas such as ovaries, fallopian tubes, bladder, or any part of the abdomen. Due to hormonal change during menstruation, this endometrial cell, whether inside or outside the uterus, bleed. This condition is known as endometriosis. If for any reason these endometrial cells are present in the ovaries, bleeding occurs inside the ovaries during menstruation, while the blood inside the uterus can typically exit through the vagina. The blood inside the ovaries cannot. As a result, the blood accumulates and forms a cyst known as an ovarian endometrioma. Because the color of this cyst resembles chocolate, it is commonly referred to as a chocolate cyst. In simple terms, a chocolate cyst forms when menstrual blood accumulates in the ovary, creating a cyst. Why do chocolate cysts occur? Chocolate cysts or ovarian endometriomas are primarily a part of endometriosis. Among women affected by endometriosis, 18 to 44% may develop chocolate cyst. While the exact cause of chocolate cyst is still unknown in medical science, several potential reasons have been identified. Number 1, retrograde menstruation. Normally, menstrual blood flows out the body through the vagina. However, if the menstrual blood flows backward into the ovaries or other areas, is termed retrograde menstruation. Easily, the menstruation blood goes into the opposite direction. Number 2, genetic factor. Chocolate cyst may also be influenced by genetic predisposition. If there is a family history of endometriosis or related condition, the likelihood of developing chocolate cyst increases. Number 3, a compromised immune system may also contribute the formation of chocolate cyst, as the body less capable to dealing with endometrial cell growing outside the uterus. Now let's discuss the symptom of chocolate cyst. The most common symptom of chocolate cyst is pain. There is some specific symptom. Number 1, the pain during menstruation. Number 2, the pain during intercourse. Number 3, pain can occur while urination or during bowel movement. Number 4, an increased need of urine frequently. Number 5, general pelvic pain that might feel like cramping. Number 6, nausea or vomiting. Number 7, menstrual period may become heavier and more irregular. Number 8, difficulty in conceiving. In some cases, chocolate cyst might not show any symptom at all. Diagnostic test for chocolate cyst. To diagnose a chocolate cyst, the following tests are usually recommended. Number 1, abdominal ultrasonography or transvaginal sonography. This imaging test can help detect the presence of cyst in the ovaries. Number 2, MRI or CT scan also detect chocolate cyst. Now let's discuss the treatment for chocolate cyst. The treatment for chocolate cyst depends on several factors such as number 1, your age, number 2, your symptom, number 3, whether you have children or are planning to conceive, number 4, whether the cyst is in one ovary or both. Based on your consideration, the treatment plan is usually categorized into two types. Number 1, medical treatment. Number 2, surgical treatment. Let's first talk about the medical treatment. If the cyst is smaller than 3 cm and there is no significant symptoms, doctor may observe conservative approach. This typically involves birth control pill. This prevent ovulation, which help to stop the cyst from growing and can also reduce the pain. However, this is not a permanent solution. Medication to manage the pain and discomfort. Number 2, surgical treatment. If the cyst is 4 cm or large and cause significant pain, surgery may be necessary. This procedure is called laparoscopy. Before undergoing this surgery, additional tests such as AMH or anti-Mullerian hormone and TBS by transvaginal sonography are often required to assess ovarian reserves, which indicates the number of eggs of woman has. Since the cyst is in the ovary, performing surgery carries the risk of damaging the ovary and fallopian tube. It is important to evaluate this risk before proceeding this operation. One unfortunate aspect is that chocolate cyst can occur even after surgery. The surgery removes the cyst, but it may not completely remove the endometrial cell, which can lead to formation of a new cyst. Therefore, surgery also is not a 100% permanent solution. However, if the patient experiences severe pain, surgery may be the best option for alleviate it. The decision of operation is entirely dependent on the patient's condition and severity of their symptoms. There are a few scenarios in which chocolate cyst can be resolved permanently. Number 1, menopause. For women who reach menopause, typically around the age of 45 to 50, the hormonal change associated with the phase of naturally resolved chocolate cyst. Number 2, surgical removal of the ovaries can eliminate the chocolate cyst. However, this procedure also means the woman will no longer be able to conceive, so it is not suitable for everyone. Fertility and chocolate cyst. Chocolate cyst can impact the fertility by damaging the ovaries and fallopian tubes. This damaging can make it more difficult for women to conceive. Studies show that 40 to 50% of women with chocolate cyst may face challenging in getting pregnant. However, research also indicates that 43% of women with chocolate cyst are still able to conceive naturally. Additionally, in vitro fertilization or IVF offers another option for women with chocolate cyst who want to have a baby. What to do if you have a chocolate cyst? If you are diagnosed with a chocolate cyst and wish to conceive, it is crucial to consult an infertility specialist. These specialists will consider factors such as your age, the size of the cyst, and your ovarian reserve to devise the best treatment plan for you. It is not always necessary to undergo surgery immediately, and have a chocolate cyst does not mean you cannot have a baby. Lifestyle change. In addition to medical treatment, adopting a healthy lifestyle can also be beneficial. Number 1, avoid fast food, processed food and soft drinks. This can contribute to overall health problem and potentially exhibit the cyst. Number 2, focus on a balanced diet which is vitamin and minerals. Number 3, engaging in regular physical activities can help maintain a healthy body. Number 4, aim for 6 to 8 hours of sleep each night, preferably between 9 p.m. to 5 a.m. Now let's discuss the complication of chocolate cyst. If the left untreated, chocolate cyst can lead to several complications. Number 1, increase the pain during menstruation. Number 2, the cyst can grow large and potentially rupture, causing severe pain and complication. Number 3, there is a risk of infection in the cyst. Number 4, there is a significant risk of infertility due to damage the ovaries and fallopian tubes. Number 5, although rare, there is a 1% risk of cyst could be developed into cancer. So, if you have a chocolate cyst, you must consult a doctor and planning pregnancy. No more today. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel for get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.